As millions of Americans were sheltering in place over the past months, we began looking at the toll the coronavirus was taking on those who cannot stay home. Agricultural workers, many of them undocumented, who were deemed essential to the nation's food supply. I've been reporting in this community for years, and as the annual harvest was starting in California this spring, I was hearing from workers who were daily having to choose between their jobs and their health.
Todos los campesinos estamos haciendo un sacrificio grande, por necesidad, sobre todo es por necesidad, por hambre, por ver a nuestra familia comer y por tener donde vivir.
Sinthia Hernandez is one of the few workers out of dozens we spoke to who agreed to go on camera. She's a broccoli picker in the Salinas Valley, a region in California that produces most of the country's leafy greens. In addition to having cancer, Sinthia has diabetes, both of which put her at high risk for complications if she contracts COVID-19.
¿No nos están dando lo esencial para protegernos?
Mala, espérense.
She works for a contractor that supplies workers to farms in the area. She told me she's expected to bring her own mask to work.
Nosotros que estamos trabajando y tenemos tantas deudas y cuentas que pagar, el dinero a veces no nos alcanza ni para comprar una sola mascarilla, que en la tienda no lo dan. Una sola mascarilla, $3-4. Y es desechable.
When we met Sinthia in April, there were no required COVID protections for farm workers, beyond general rules about masks and social distancing. Even now, companies don't have to tell workers about outbreaks.
Quiero tomarme hasta un ibuprofeno. Que me duele mi garganta.
If one farm worker gets sick, you're going to get a crew, which is typically 30 people, sick. And if each of those people goes out, they're going to get 3 to 4 other people, because that's the infection rate. And so the thing snowballs.
Good morning. Good morning.
Dr. Max Cuevas runs a network of clinics in the Salinas Valley that primarily serves farm workers.
And so with my staff, I told them we need to plan. With whatever little resources we have, we need to plan to make sure that those resources are in fact available. So we thought, let's jump in, let's begin making masks.
Just before dawn, Dr. Cuevas' team was meeting workers as they caught rides to the fields.
Buenos días. Somos de la Clínica de Salud, estamos regalando máscaras. ¿Le gustaría? Oh, sí. Ok. ¿Va a venir más gente? Somos de la Clínica de Salud, estamos dando máscaras. ¿Le gustaría una? ¿Le gustan máscaras? Estamos regalando máscaras. Una para ti, una para tu esposa. Máscaras, ¿quiere máscara?
When our state and federal governments announced that the farm worker was a part of the essential workforce, included with healthcare, first responders, police, it's not your middle class essential worker that people are talking about. This essential worker, a lot of them do in fact live in fear. They don't want people to know that they're here undocumented. There's that fear of, I could be gone tomorrow if I'm taken away, and what's going to happen to my family. It's a horrible kind of fear that people learn to live with. You try to assure them that don't be afraid of that one right now, be afraid of the virus.